So Gloria, from the questions that have been asked and from what Jordan has said, I think there is consensus from most of the people in our audience today that there is need for more youth engagement and more youth voices being out there. So the question today is, how do we leverage youth voices to advocate for more youth inclusion in the UHC agenda?
Thank you, Hilary. Thank you to my colleagues, Jordan and Winnie. How we can leverage youth's voices in the participation of UHC. We can start by involving the youth in the plan to bring Uganda to UHC by 2030. Earlier at the stakeholders meeting, Honorable Jen Acheng addressed that Uganda is on a comprehensive roadmap to bring universal health coverage. I'm of the view that the team that is putting up this roadmap to bring Uganda to UHC by 2030 has youth involvement. Take an example of the newly commissioned Fourth Industrial Revolution Task Force. It was commissioned in April by His Excellency. It had quite a good representation of the youth. So I'm of the view of that's what should be applied to UHC. And you know, our generation is driving the UHC agenda, but it's mostly going to be beneficial to the people in secondary and primary. Yeah? So I'm on the view of the way we have patriotism clubs, they should also kind of try and introduce UHC clubs. Teach the young ones health promotion and rights to health is there is a right to health and about health promotion, so that they can also go and be ambassadors in their homes. You know, they can go and tell mommy, we learned this about health. Health is a right, and everything about health promotion. We could also try and empower the youth. It's about empower the youth on advocacy skills. As I once read, if you didn't write it, it didn't happen. And all healthcare professionals must be advocates. In our line of work, you're required to document a lot, cases, reports, presentations. So they need these skills, the writing skills, the public speaking skills, the self-branding skills. If only we could have that put into our education system somehow, yeah, as part of our training, that would also be a move. Then we could also try to develop relationships, stakeholders and student-led organizations. Now, imagine a student-led organization like Makerere University Pharmacy Students Association having a relationship with like NDA, NMS, or Minister of Health. Take an example of if NDA wants to run a drug abuse campaign. And you know, NDA has the money, it has the knowledge it wants to give, but they do not have the student dynamics. It would be a mutually beneficial relationship where the people at NDA are bringing the knowledge and the money, and the people at the Makerere University Pharmacy Students Association are bringing the dynamics of the students. So there is what everyone is bringing to the table. So on the part of involving the youth in this UHC agenda, I beg that we have competent youth added to the task force, not politically driven or politically appointed. We should also have inclusiveness, like women, poor, and all that. So we should also learn to hold our leaders accountable. And the way there was this hashtag on Twitter, know your budget, know your budget. So we know that 2.6 trillion was given to the health sector, but what have the individual bodies been given, the individual MDAs, what have they been given? So you could take that and wait until the end of the financial year and go to them with your statistics and background and knowledge laid, and like, they gave you this money and we're not seeing results for this. We're not seeing anything you've done that equates to this. So that would help us. That will help us drive the agenda. And also, I know everyone is, my colleagues were kind of negative, not really negative, but they were not satisfied with the National Health Insurance Bill. But I would say it's a drive towards the UHC, because you're going to have a percentage of your money taken off and put into health insurance. And even the youth that are unemployed are going to be able to get quality medical care because of the percentage our rich counterparts are going to be adding on to the health insurance bill.
Audience. But I have two kind of, I don't know that the comment is kind of an awkward statement. I want to first see whether I can turn it into a question. One is where I sit, maybe this is old age and I'm not very much a social media person. The problem we see from our side is youth preparation for job market and to bring functional skills to the productive industry. That's one of the areas we think we can leverage eventually to turn the youth energy and communication and socializing into productive economy. So maybe the question is there is, as the youth panel, and maybe Gloria, you can start with it, but I don't mind if the others also come in. How do you see that? In the morning, somebody said that the education system, especially for girls, only helps up to P7. Did it say P7 or senior 4? Beyond that, it doesn't seem to add to child survival. That is just to give you, people like us, how we analyze our data. So the point is, how would you respond to this kind of information? How do we get education to continue to be powerful beyond the basics? And what would you expect from the basic education, at least for as the youth, so that we can say you can have to negotiate your way out of maybe unsafe sex or situations that could get them pregnant? These are the public health problems we see. Negotiate your way out of early marriage, negotiate your way out of, cultural behaviors that may make you, well, those are issues from a public health sense. So my way is, if education is one of them, how can we make it more deliver, and at what stage should it be able to deliver those skills that can make the youth start to be able to be empowered, but also to negotiate out of the traps that we see. And then the last one is, I like the point that was mentioned about information, and how it can move down to the communities to empower the youth, especially that might be even out of school. But I like the practical submissions from Gloria about school youth clubs and several others that you've mentioned. And I like the example of if you have drug abuse as a problem among the youth, how can you work with a government agency to use those clubs that could, but those kind of practical approaches I think are very useful for government, especially to my colleagues who do planning, but also for us to figure out in terms of research, how can we engage the youth to actually do research around the things that matter to them, but also matter to public health. And this is sometimes confusing. That's why me as a public health person, I keep bringing those issues the way we see them as like problems, but for you, you also might see them as problems, but might not be exactly as problems. The example I want to give shortly is that everyone is concerned that if you also choose to have 7 children as families, then we are going to have a population explosion. I don't know whether that would be infringing on your rights, but the issue is that the economy is asking for less and less children for people like you who are entering reproduction.